Welcome to Frontiers in Medicine, where we host conversations on biomedical and health-related research at the Joe R. and Teresa Lozano Long School of Medicine. The Long School of Medicine is committed to addressing the healthcare needs and priorities of the diverse patient population of San Antonio, South Texas, and beyond. Today, our conversation is on living healthier longer. Joining us is Dr. Elena Volpi, Director of the University of Texas Health Science Center at San Antonio's Sam and Ann Barshop Institute of Longevity and Aging Studies, Dr. Sudha Seshadri, Founding Director of the university's Biggs Institute for Alzheimer's and Neurodegenerative Diseases, and Dr. Rob Hromas, Dean of the Joe R. and Teresa Lozano Long School of Medicine.
Thank you for joining us for this podcast on dementia and aging and what you can do about it. We're thrilled to have two experts here, and I will introduce myself and then ask them to introduce themselves. My name is Robert Hromas. I'm an oncologist by training, and I'm dean here at the Long School of Medicine at UT Health San Antonio. Dr. Seshadri, please introduce yourself.
Thank you, Dean Hromas. I'm Sudha Seshadri. I'm a behavioral neurologist, and I'm director of the Glenn Biggs Institute for Alzheimer's and Neurodegenerative Diseases here at UT Health San Antonio, and a professor of neurology. I'm delighted to join you today.
Thank you, Sudha. Dr. Volpi.
Thank you, Dr. Hromas, for inviting me. And I am Elena Volpi. I am an endocrinologist by training and a geriatrician by trade. And I'm the director of the Barshop Institute for Longevity and Aging Studies, and a professor in the Department of Medicine, Division of Geriatric Medicine.
We are excited to have you both here today. You're both international leaders in your field, and here I expect to hear great insights on how I can slow my own aging and keep my own brain sharp. So I'll start with Dr. Seshadri and ask you how you first got interested in the biology and treatment of dementias.
Growing up, I had some personal experience of the challenge of having a parent with a dementia-type illness, and fascinated me about this brain, which is so integral to who we are, to our memories, to our ability to communicate. And when I entered neurology in the 90s, this is the time when there were a lot of exciting advances in dementia. Dementia was not even considered necessarily a part of neurology, but for the first time, we were recognizing ApoE, all the Alzheimer-related, early onset Alzheimer-related genes, and realizing there's an amyloid, a tau, and maybe if we are able to do something about this biology, we can prevent people from having dementia. So that's obviously drove the excitement. It was followed by the decade of the brain, and it has continued to be a very exciting field.
Dr. Volpi, how did you first get interested in aging?
My interest is serendipitous because I trained as an endocrinologist back in Italy, and then I moved to the U.S. for a postdoctoral fellowship. And at that time, I was in Galveston at UTMB, and my postdoctoral mentor wanted to start studies on aging. And so I was hired by the Seeley Center on Aging of UTMB to become the first fellow of Dr. Bob Wolf to do studies on aging. Dr. Wolf was doing studies in burn children at the time, so it was a complete change of direction for him. And I became really excited about it because I started studying muscle in older adults, and I noted that there were several alterations in the muscle metabolism and biology that could be the fundamental cause for physical dysfunction and disability in older adults. And so I became more and more interested. And as I started to do clinical studies, I really became very excited by the depth and engagement that my research participants actually were exhibiting, and they did it for the sake of science, not for any other reason. And there it started, and then it was like a snowball effect, and I'm here today.
So looking back on your extensive research career, as you investigate the science of aging, what do you think plays a bigger role? The genes we inherit, or our lifestyle that produces epigenetic changes that modulate those genes?
Well, the genes is the hand of cards we're dealt with at the beginning of our life, and there's really little we can do about that. Definitely they may play a really big role, particularly certain genes, for certain specific diseases as far as we know. On the other hand, I think that the most important piece that we can act on is lifestyle. And so whatever is the gene pool we're dealt with at the beginning of life,
We're stuck.
we're stuck. And so we can't really choose our parents, but we can choose how we live our lives.
So one of the things that struck me is the revolution in epigenetic control of gene expression. Dr. Seshadri, in dementias, how can lifestyle changes affect gene expression through modulating epigenetics of our brain?
While your genetics is predetermined, regardless of how severe your genetic burden is, a positive lifestyle does seem to have an impact on as much as halving the risk that you inherited or doubling the risk that you inherited based on whether it's a positive or a negative lifestyle. So it doesn't matter, even in dominantly inherited variants of Alzheimer's disease, lifestyle changes, vascular risk factors seem to modify the expected age at onset. The genes play a greater role when we are thinking about disease that begins very early or when we are talking about exceptional longevity. When we are talking about the vast majority of us, twin studies suggest that genes maybe contribute to about, for Alzheimer's, they say about 50%. But that still leaves about 50% that is completely modifiable. And even if you're in the highest quartile of Alzheimer's risk, based on ApoE and 90 other genes that we have found, abiding by the essential 8 that the American Heart Association emphasizes halves your risk from what it would be if you had exactly that same genetic profile, but average rather than an ideal cardiovascular health profile.
So you mentioned the American Heart Association recommendations to promote a healthy brain. Give us some examples of things you can do to protect your brain health as you age.
So I will go over it with the caveat that most of these have not, or none of these have yet been proven to prevent in the traditional double-blind controlled trial. Most of this is from observational studies. Those 8 factors are sleep, exercise, keeping blood pressures under control. This is very important for preventing stroke, which in turn is a major risk factor for dementia. Keeping blood sugars under control. Related to that is obesity and insulin resistance. Exercising, making sure that you have. The staying cognitively and socially engaged with, a purpose in life. That is a very important factor. I lost count of whether I covered all 8, but these are some modifiable factors. I do want to point out that lifestyle is not always a choice, and so the environment determines to what degree one can lead the ideal lifestyle. The availability of fresh foods, for instance, and say the environmental air pollution or other toxins. But to the extent, which reminds me, the one I left out, the very important one is smoking. While the nicotine itself may have some beneficial effects in Parkinson's and Alzheimer's in synaptic transmission, smoking is unequivocally bad for you in so many ways, including increasing the risk of dementia.
Dr. Volpi, would you add anything to that list of interventions that the average person listening to this podcast could do for aging?
Nutrition. That's the other big one that is very critical to a healthy aging. So we do know that certain types of diet, the so-called Mediterranean diet, which is kind of a difficult concept to digest for me, who I'm from the Mediterranean Sea, because each Mediterranean country, even each city, has a different diet. So, but it apparently is the diet and perhaps also the lifestyle of the Mediterranean people that really provides them some benefits and allows them to live longer and healthier lives. And so a diet with plenty of fresh fruit and vegetables, with legumes, with fish, with lean meats, also dairy. It's very much widespread use of dairy, particularly sheep cheese. It's something that it puts in common at least the Mediterranean blue zones of longevity. So both Sardinia and Greece are both very strong producers of sheep cheese of some sort. There is also the try to reduce the amount of saturated fat. In fact, the Mediterranean diet includes monounsaturated fats. They are found in olive oil. And so those are all items of a regular diet that could probably, that have been linked, at least in large observational studies, to extended lifespan and health span, which is the percentage of our life that we live healthy.
You mentioned blue zones. They're a fascinating topic. Those are geographic areas limited in nature in which the population lives much longer and healthier lives. So they not only live longer, they're much more active during their long life. And there are a couple you mentioned in the Mediterranean. There are others around the world. What's in common about those areas as you study these blue zones?
So the blue zones are in very different countries and also continents. So there's 2 blue zones in the Mediterranean, as already mentioned, in Greece and in Italy, in Sardinia, which is an island of Greece. There's another island off Japan, is Okinawa, where there's another blue zone. And then there's other 2 places in the Americas. One is Loma Linda, of all places, and the other one is in Costa Rica. So most of them are close to the ocean, to the water. So one can think about, fish consumption could be one of the beneficial reasons for that might justify longevity. But as I mentioned earlier, some of them are not on the sea. For example, the Sardinian one, Sardinia is an island, but the blue zone, so-called blue zone, is in Barbagia, which is in the middle of the mountains of Sardinia. And so they don't eat much fish there. But probably is also the lifestyle. So the mode of transportation is their own legs most of the time. They don't use cars. They actually grow their own foods, or they grow or gather their own foods. So you have fishermen or shepherds or farmers, and so that's another way probably another link among those blue zones. And then there's unknown factors. Probably there's also genetic selection, because these areas have been in part secluded over the centuries, and so maybe there's been some sort of evolutionary benefit and advantage there. We don't really know. They tend to be more homogeneous in genetic terms, those populations, and so that's the big and the contact with nature and the social aspects of life are very important.
Interesting. Dr. Seshadri, are there blue zones for dementia around the world as well as for aging?
There is less uniform data on dementia, but as you mentioned, these blue zones are areas of superaging, where people not only live longer, but live dementia-free for a longer part of the time. And it seems that as you grow beyond 90, even the effect of dementia genes like ApoE become less, so that if you're a centenarian, it doesn't matter if you have E4, because you clearly have other protective factors. One important thing that's been emphasized with this social cohesion is the sense of purpose, which can be either working, volunteering, that we have shown, for instance, that perceived loneliness, even with people with the same brain size, people do better on cognitive testing, are more likely to be dementia-free if they have someone to talk to. People are impacted by their friends' social behavior. These have been papers on social networks in the New England Journal and things. So the diet also has this indirect effect of impacting the gut microbiome. And we know today that our body chemistry is not just what our cells produce, but what the microbes in our gut produce. And gut dysbiosis has been linked to not just dementia, but to some of the antecedents of dementia. We're just beginning to understand this area and consider it as a modifiable thing. Something that is very fascinating to me is if you carry a gene for something called cerebral cavernous malformations, you have 20, 30 of them in the brain can cause seizure and bleeding. In mice, if you put that CRIT1 gene in, they have the CCMs. If they are germ-free mice, they don't develop any CCMs.
Really? So the CCMs come from some microbe in our intestines.
Gene-environment interaction, as you were saying, epigenetic. Because other mice which have the same microbes probably don't get the CCMs. But if you have CRIT1 gene mice and you raise them in a germ-free, they don't seem to get the CCMs that the CRIT1 normal environment do.
It would be interesting to think of a day when we could take a certain type of bacteria or yeast or virus or fungus orally that would modify our intestinal microbiome and prevent dementia or aging. What are the microbiome effects on aging?
They're being studied as we speak. In fact, there is this potential for microbiome to actually induce epigenetic changes and also acute changes in metabolism, for example. The microbiome has been linked to diabetes prevention and occurrence. And so it's very important that we better understand how this interaction between microbiome and the fundamental mechanisms of aging occur, which is one of those exciting areas, new areas of research over the past few years.
Dr. Seshadri, tell me one thing that you've learned from your research on dementia that you've incorporated into your own lifestyle to help keep your brain healthy as you age.
I think exercise, at least I try to, because we know that every step one takes helps. Unlike the heart, where you're advised to do about 30 minutes at least 3 times a week, with dementia, it's the sedentary time that's really bad for you. So right across the spectrum of increasing steps, it seems to be beneficial. And then, of course, as you pointed out, unprocessed, natural local fruits, they seem to promote a healthy microbiome. One of the strengths at UT Health, I think, is our tight link between the basic science and the clinical. So we have been talking to Dr. Zadeh about an intervention that may change the gut microbiome and whether we can do some phase 1 studies in some of our patients.
Right, his bacteria, PF.1, may promote a healthy brain, and that's a very exciting clinical trial that we can start right here at UT Health San Antonio. Dr. Volpi, what have you learned about aging that you've incorporated into your own lifestyle?
Well, I do try to keep my diet as Mediterranean as possible, so I cook at home. I mostly cook every night. So I have my quick recipes for the night, for the family, so that we can actually continue to eat freshly made foods, even traditional.
What are some examples of meals that you...
I can make spaghetti with tomato sauce, and then last night we had eggplant with mozzarella on top and tomato, and so those are, and the meats, obviously we can have chicken, we can have chicken with prunes, for example, that I make. So there's things that can be done even in a quick way. In fact, that's one of my pet projects, is eventually, when I will have time, is to actually come up with a recipe book for quick Italian recipes.
Okay, to help maintain a healthy lifestyle.
Yes, and then the other thing I do is obviously exercise. I try to exercise every day, if I can. I end up doing it 4 or 5 times a week, because obviously there's always something going on. But I try to keep my step count high. So if I'm in the office, instead of placing that phone call, if I have the time, I walk down the hall to talk to people. So I try to park as far away as I can when I go to the store, so that I can log in a little bit more step and physical activity. Clearly, the way American cities are built, they make it a little bit more difficult to keep an active lifestyle. When I'm visiting Italy, obviously I always walk a lot more. I mean, I can log 20,000 steps without even noticing, just because I went to the center, came back, went shopping on foot. So those are the differences that really can impact our health span and lifespan. And then I try to maintain my social connections. So for example, in my house, we have dinner together. We don't have dinner in front of the TV. So we try to stay together and at least keep our family nucleus tight-knit. I try to see friends. I try to also connect with friends even if they're far away, because it keeps that social interaction very important. And obviously reading a lot, keeping your brain active. And that's also one of those things that we probably all need to consider to keep our cognitive function always activated. And then try to get some good sleep at night.
Thank you for listening. The University of Texas Health Science Center at San Antonio, also called UT Health San Antonio, is the premier academic and bioscience research organization in South Texas and is a primary driver of San Antonio's $44.1 billion healthcare and biosciences sector. With an annual research portfolio of more than $360 million, the UT Health Science Center San Antonio is the largest academic research institution in South Texas.